Welcome back on this Wednesday morning, now at 9:22. For the past 10 years, lung cancer patients, survivors, doctors, and loved ones have gathered for an important conference put on by the nonprofit organization Longevity. This year, the free event is going virtual, and I recently spoke to a doctor learning more about lung cancer and the advances now in treatment. Dr. David Carbone is a thoracic oncologist at Ohio State University and is joining us this morning via Zoom. Doctor, good morning to you. Let's just jump right in and talk a little bit about statistics that you're seeing when it comes to lung cancer. What do you want people to know?
Well, good morning. I want people to know that, first of all, to understand the magnitude of the disease, that it's the number one cause of death for both men and women. But we have managed to double the 5-year survival for lung cancer over the last decade through some very exciting advances in therapy.
Not just therapies too, I want to talk about that, but it seems like you guys are able to, at least from what I've read, you're able to detect lung cancer even earlier. Is that what you're seeing? And kind of tell us more about that along with some of those therapies.
Well, part of the improvement in survival for sure is early detection. And I think people recognize the importance of getting mammograms and colonoscopies and prostate exams for other kinds of cancer. But until recently, there was no early detection for lung cancer. But now it's an accepted method to reduce the number of deaths of lung cancer to get an annual low dose, what's called a spiral CT scan. And that can reduce deaths from lung cancer dramatically.
When we think of lungs right now, we think COVID. We're hearing all about COVID every day, and we're thinking about our lungs. What do you want people to know as far as a COVID patient, maybe, and maybe in lung cancer as well?
Well, it's very clear to me that lung cancer is more of an impact on your health, potentially, even than COVID. I mean, even with the recent advances, still only a few percent, maybe 20% or 15% of lung cancers are alive at 5 years. So I tell my lung cancer patients that they need to first focus on treating the lung cancer, but to be cautious about getting exposed to the virus because they are definitely more susceptible.
And when you're talking about screenings, at what age do you suggest someone start getting screened, and does insurance cover that typically? I mean, I know there's a question about insurance for a lot of people too.
Yes, that is always a concern, and the guidelines just recently changed, but typically the recommendation is that screening should be restricted right now to people who have smoked and quit smoking less than 15 years ago. They have to have smoked a certain amount, and they have to be over age 50 to meet the current CMS guidelines for paying for smoking for CT screening. Unfortunately, there's a lot of people who get lung cancer who are not included in those specifications. And in fact, if you look at the total number of people in the United States that fit the criteria for CT screening for lung cancer, only about 2% or 3% of those people actually get screened. So I think it's a good place to start, making sure that all primary care practices and pulmonary practices encourage patients who are eligible to get a screening CT scan.
We only have about 10 seconds left, but I quickly wanted you to mention this conference that you wanted people to know about.
Yes, this is the International Lung Cancer Survivorship Conference, right, from Longevity. It's a very important conference to stress the importance of advocates and lung cancer to the community.
Well, we will put that information online so people can figure out more about that and if that's something that they want to be involved in. Doctor, we sure do appreciate you helping us get the word out this morning. Have a great day.
You're very welcome. Thank you.
And now back here live to me now. The 3-day conference is Friday through Sunday. It's free. You do need to register to check out those speakers and the sessions, and you can sign up fox59.com/links.